morning. How are you doing? How can I help you today?
Assess how I am and explain why you were prescribing wrong antibiotics to me for 5 months.
Which wrong antibiotics?
I went to infectious disease and they said that the last one that you prescribed was the one that you had to prescribe me.
The ciprofloxacin based on your last culture. That was based on your last culture.
Yes, this
Based
is
on the
for,
previous cultures, you didn't have any indication for ciprofloxacin.
well, I had gram-positive and gram-negative
You
raw
saw Dr.
sepsia.
Stone before, you had Pseudomonas, she prescribed the gentamicin, doxycycline is a broad spectrum antibiotic. Your previous cultures didn't even not show which antibiotics you had to take. The only culture that showed the antibiotic that you had to take was the last culture that we did, and after that I immediately prescribed the ciprofloxacin. I think at this point you already saw other two providers. You have your personal opinion who you should continue following to, and then you make your decision who you want to continue your treatment with. If you have any other complaints, anything else you need to address, you can speak with patient experience. I think they contacted you last week. They can clarify your questions. You can talk to them all the way. If you want to continue the treatment with me, I need to speak with our psychiatrist who prescribed your Adderall to you, because in my opinion, that's correlated to what you're having right now. So if you want to continue with me, that's the way it should be done. But you have other two providers, you're free to see other people, and you have the records with you, and
Yeah,
you're
but
free
the
to do
records
that.
are falsified. You're saying that I'm cured, you're not putting that I'm bleeding, that I have pus, that it's getting worse. You are not putting anywhere. I looked at it. And I
Okay.
sent you emails and you're not doing it. Why are you
So
omitting it?
can you show me the problem in the records?
All the other lesions healed well.
Do you understand what PMH is?
No, so I need some better explanation.
Okay, so PMH is your past medical history. This is when you came previous visit, and you told me, look, I have a new lesion on my left arm. The other lesions that I had before in my arms, they healed well. That's a note that we make based on your previous medical history. The PMH is previous medical history. So in the same visit, you will find the current problem, which is on top. It's like in the beginning of the record, you will find that it's not previous medical history. It's the current medical history. It's the visit for today.
And then you write that you talked to me about side effects, but you did not.
Yeah, so we spoke about that. We were in the other room. You were using triamcinolone in your body for a long time, and then I told you, I'm going to change you to hydrocortisone for your dermatitis. You're using triamcinolone for a long time. Triamcinolone is a steroid that has side effects that include skin thinning, may make your skin develop telangiectasias. I'm gonna take it, I'm gonna reduce the dose to hydrocortisone, and hydrocortisone is also a steroid that has the same effects but is less. That we spoke 3 visits ago when you were sitting in the other room, and here in this record you see that that's continuing. When you see CO and D is continuing a previous treatment. That's the reason why it's there.
So please assess me now and please tell me what to do next.
So I believe you already saw, my opinion is, once you have to let me know, speak to your psychiatrist. That's the first thing I would like to ask you. I will take pictures of your lesions, I will check you today, but if you need to make a decision if you want to continue treating with me, Dr. Stone, or the infectious disease. So you pick one of the three and you keep going, okay? You're already taking the ciprofloxacin, which is the latest antibiotic that your culture showed, the last culture showed that one of your lesions was sensitive to that. So
and
you're
the one
already
that
taking
doctors
that
don't take, what are the results for that one?
I don't think I have those results yet.
And because what worries me is that when she took it, this black dots here and here. After that, I developed this. After she took it, and that black dot is still there. So this is after that visit, I got this, which is like was very swollen, and even now it hurts.
Well, you need to make a decision because every time you come here with a different wound and we culture you and comes something different and your nails are long and you're
No,
putting
no,
pressure.
you're not.
You're putting pressure on them if you're touching them. One thing I also told you, your lesions must be covered all the time.
Yes.
All
With
the
the
time.
gauze pad and with the I tape. With
Yeah,
the
but you
medical
walk
tape.
here in the clinic always with the lesions uncovered. So you're walking on the
Oh,
streets
no.
with them.
I use that and on purpose because I live on the first street until I walk here, so I
And you
don't
need
have
to
to take it
cover
out.
not only with a shirt, you need to have like a wound bandage.
Yes, I have it,
you
but
know?
because I'm seeing you, I'm not
So-
going to be taking
Yeah,
it.
it's because you have even to walk in here with that. Okay, here is healing. It's a biopsy process that you have. Here is pretty dry. You don't see like pus here for us to take the swab.
Yes,
so it's
but
like dry.
two days ago that you got it swollen and got out.
Same thing here. So a culture here is going to show your normal flora. You're going to be swabbing what is
No, I
swabbing
don't
on
want
your
to swab.
body.
I'm just
you know?
saying that this developed after that.
Yeah.
She took that.
So you are already on the antibiotic. My
I just
recommendation
have,
to you is you should do the antibiotic as infectious disease said to you. He also recommended you to see an immunologist to check your immune system. I particularly need to speak with our psychiatrist. These lesions must be covered with mupirocin all the time to see if they heal, and do not touch them, because if you do, if you put pressure even when you're showering, or if you're gonna throw the garbage without them covered, this is what's gonna happen. You might develop new ones.
I have only for 2 more days for that medication, by the way. So
So I think the doctor placed another order for you in the system last week.
for 1 week, so I have 2 more days after that one.
And that's also an antibiotic, so the problem is you cannot be on that forever. You know what I mean? That's a very strong antibiotic. The reason why you're developing new lesions, I'm not sure. I can give you 1 more week, but after that I would recommend you to see the infectious disease, to follow her plan in terms of seeing immunologist, speaking with our psychiatrist, because we're running out of resources here. Because the lesions, you're developing new ones, we don't know why you're developing new ones, and you are taking Adderall, which is a medication that stimulates your nervous system. So your skin is very inflamed, and Adderall could be contributing to that. So I need to speak with her psychiatrist. That's the first thing I have to do. So you need to provide her, if you want to continue with me, you're going to tell Fabi that you want to continue treating with me, and then you need to follow what I'm saying, and I'm going to talk to the psychiatrist. If you don't want to continue with me, then it's fine. You're going to find another doctor who has a better opinion, and you follow whatever they're saying.
I use it. I'll think about it.
Okay? So you make a decision. So for your medical records, so what I'm saying to you is, past medical history, if you feel that that's wrong, or if you feel that we never discussed about the corticoids, you can write patient experience, they
Yes,
already.
I got the form already, the private.
So you can do, they have a whole committee, they will review the record, they'll let me know, then they'll get back to you. They'll get back to you, okay? So I'll give you 7 more days of ciprofloxacin, and then you follow up with the infectious disease, follow her plan, because I think she has a plan for you, which is reasonable.
No, she
to
has,
se-
it's he has
to
no
s-
plan.
To send you to immunology.
I actually have not heard about that I have to be sent there. You are the first one who's telling me that.
What?
You are the first one who's telling me that. He did not tell me that.
What?
That I have to go to immunology.
Yeah, it's in the records. I don't know if you got a copy of the records.
I'm at this point I'm confused. Just please give me a moment antibiotics and I'm gonna go.
So then, so what I'm gonna make a note to you in your, probably please take pictures of her arms, please. Let me just check her, can I see her belly and her back? Can you turn? Okay.
That thing was
We're
here
gonna
since
take a
the first
picture.
time discovered when I got the blood out of the belly button. That's a doctor's
like-
stone that okay, but it's still there for like 5 months.
Yeah, that's now a scar. It's like a hyperpigmented scar, okay? So can you take a picture of her belly, of her back, legs, and arms, please? And by the way, just explaining about doxycycline antibiotic you were taking. That's a broad spectrum antibiotic that we prescribe for acne, sometimes for up to 3 months to improve acne. When the person comes here full of little erosions like you had before, the mosquito bites, remember you were telling me that you didn't know if they were bites, they were very infected?
Yeah.
When you have an infection like that you culture, but doesn't come anything major, or skin flora, or staphylococcus, that's the correct antibiotic.
Yeah.
Because that helps you with the itch,
Yeah.
also helps with the itch, and helps not to get
Yeah,
infected.
it did. It stopped itching at that point, but then when they started developing the wounds, they started opening the itch completely different.
So,
it's
going back to your history, you had little ones,
Yeah.
and then one day you walk in here with a larger one on the arm, and then the larger one, I said, okay, you're gonna culture, you're gonna do biopsy, which we did. We did a biopsy and we did a culture, and I want you to understand that this is not me who writes the results, we send to labs. So the lab sent us back, what is that? So your biopsy was saying, looks okay, there's not even bacteria.
It's here too, I think. Yeah, you need to show it.
And then, I have one little one here. So, that's what we did for that one. And then the week you came, 2 weeks later, you had 2 new ones here. Then we did a new examination of the new ones.
But before that,
Yeah.
you did not prescribe. You kept continuing that. You kept continuing prescribing the same antibiotics, even when I started coming with the dose. It was only 2 weeks ago
Was
when you prescribed it.
Because that's the moment I had the culture in my hands. Was the third culture that I did in your arm on the right side. When I did one of those cultures, that the lab informed me that that bacteria in that arm was not responding to the Bactrim that you're taking, prescribed by your PCP. That bacteria was covering ciprofloxacin, but it was only after we did here, on the right side.
Well,
You have to understand that
But-
each culture that we do shows a different result.
But about the one flesh-eating bacteria, how come that one did not show anything about
That's not
Gram-positive?
me, that's the lab. It's the lab that does it. It's the lab that does it. And the lab was there's no evidence of flesh-eating bacteria. So the culture that showed that was sensitive to ciprofloxacin was the one on the right arm. The last one we did. This one here didn't say anything about
Yeah,
any
but-
antibiotic.
Which is so weird, right? Because
Because depends on the colonization of that wound. Each wound can be colonized by a different bacteria. So there was absolutely nothing wrong done on the process. Nothing wrong done on
I'm
the
just so
process.
unlucky, I guess.